The Foundation for the Children of the Californias, a binational nonprofit corporation dedicated to promoting the health and nutrition of infants and children in the border regions of Tijuana, Mexico, and San Diego, California. In the next few minutes, you will meet Dr. Gabriel Chong King, a pediatric surgeon and hospital director in Tijuana, Dr. Elizabeth Jones, a pediatric nutritionist from San Diego, Dr. Vesta Richardson, a pediatrician and head of the Pediatric Residency Training Program in Tijuana, and Dr. David Collins, a noted pediatric surgeon from Children's Hospital in San Diego. Throughout the past 20 years, Dr. Chong King, Dr. Jones, Dr. Richardson, and Dr. Collins have worked together as both healthcare professionals and volunteers, addressing the medical, emergency, and nutritional needs of children in Tijuana and the surrounding area. They are here to discuss the critical health care needs of children as well as some of their highly successful programs, which have, over time, led them to the creation of the Foundation for the Children of the Californias. Dr. Chong King speaks from his own perspective as a pediatric surgeon, as well as from the experience he has gained from 12 years as director of a major hospital in Tijuana.
The mission and purpose of the foundation is to provide qualified services of medical specialists for the children in the region, in a special hospital that is adapted to the needs of doctors and the children. Service and treatment must be complete, exact, and quick, and be given in a place where the little ones will be offered love, compassion, and understanding. Baja California is one of the few states in all of Mexico that doesn't have a children's hospital, even though 50% of the population is under the age of 18. In Baja California, accidents are the third major cause of death in children. Any child, regardless of social status, is likely to get into an accident. We don't have a hospital that can provide comprehensive care in response to critical trauma in children. The first hour following an accident is the most important one if we're to prevent irreversible problems. Right now, it can take more than 2 hours to get a child across the border and admitted to a hospital, making the chances of irreversible damage very real.
Border traffic is a constant and time-consuming barrier around which there is no quick or easy solution. When an accident involving head trauma occurs, the golden hour, that first hour within which treatment must begin, quickly ticks away. Among the estimated 1 million infants and children living in and around Tijuana, a minimum of 84,000 of them will require medical care each year. Conservative estimates suggest that more than 60% of these youngsters will not have access to the care they need. In addition to accidents, the most common problems in children include severe malnutrition, respiratory diseases, and diarrhea, a serious issue because it leads so quickly to dehydration, starvation, and even death. Access to care is the obvious and inevitable solution. Dr. Jones has volunteered her services at East Acali Hospital for over 12 years. The highly respected programs which she describes identify real success and clearly reflects the increased level of care which a specialized pediatric hospital and nutrition center will provide.
Recently we had a baby who needed cleft palate surgery, but when we checked this baby for the laboratory examination prior to the surgery, we discovered that the baby's hematocrit was only 27. This was much too low to allow that baby to go to surgery. We were not able to find iron supplementation to give this baby for the desired length of time, although we were able to find it for about 1 week. Therefore, instead of using supplemental medicine such as iron, ferrin sol, or such as medication, we decided that we would have to use dietary modification in order to increase that baby's hemoglobin level. We were very, very fortunate. Within 2.5 months, when we measured the hemoglobin again, we found that the hematocrit had increased to 42, and we were able to send this baby to surgery and had a successful outcome. Another thing that we do here in this hospital is we encourage breastfeeding. we have found that babies that are breastfed don't get sick. Another thing that we are doing that encourages breastfeeding is with our premature babies, we have a program of skin-to-skin treatment whereby the mother or sometimes even a nurse will carry the baby skin to skin when it's very tiny.
It is said that each physician will treat over 150,000 individuals in his or her lifetime, making education one of the most powerful tools we have to work with. Dr. Richardson, speaking as both pediatrician and head of the Pediatric Residency Training Program in Tijuana, talks about the importance of a teaching hospital.
The educational program for residents provided at the hospital is one of the most important experiences of their medical career and will greatly impact their future patients. This program in postgraduate pediatrics at the University of Baja California is one of the most respected academic programs in all of Baja California.
For 20 years, Dr. David Collins has volunteered his time as a physician and surgeon, working hand in hand with the medical staff in Tijuana.
One of the most interesting developments to those of us doctors and nurses from San Diego who over the years have enjoyed going down to Tijuana to assist with medical care of children there has been the formation recently of a group of people who are dedicated to the goal of building a children's hospital in Tijuana. Tijuana is a city of 2 million people or more, probably bigger than San Diego. It's the biggest city in Mexico at present that does not have a children's hospital. We have made some excellent progress in identifying support on both sides of the border. One of our most important supporters in Mexico has been the governor of Baja California, who has guaranteed a plot of land situated near the Otay border crossing, an excellent location on which the hospital will be built.
What you have seen and heard is expert testimony, given in demonstration of the need for a specialized pediatric hospital. This foundation is committed to building that hospital. Located 2 miles from the Tijuana airport and 1/2 mile from the Otay border crossing, this pediatric hospital will be the first of its kind in all of northwestern Mexico. Open and staffed on a 24-hour basis, it will serve as a leading center for diagnosis, assessment, research, education, and treatment. It will send medical teams out into the community, bringing medical care, education, and service to large numbers of children and their families. And it will serve as a primary resource for physicians, nurses, researchers, and educators. Trained specialists from both sides of the border will continue to work together to make this dream a reality, assuring accessible treatment and care for children in need. Construction will be completed in 2 stages, beginning with Darte and progressing over a period of 10 years to a full pediatric facility with 82 beds. The projected cost of the entire 82-bed hospital is $12 million, with $6 million as the immediate fundraising goal. We've had an excellent beginning. The land needed for the hospital has been generously donated by the governor of Baja Norte, and over $250,000 in professional services were contributed within the first years of planning. The remaining funds, coming from individuals, governments, corporations, and foundations, will allow construction to begin by the end of 1994.
The Foundation for the Children of the Californias was formed in response to the lack of a pediatric medical center in Tijuana. The foundation has grown to over 100 enthusiastic, qualified professionals with important positions from top institutes in Mexico, the U.S., and Canada. All have been willing to donate their time and expertise for this project to benefit children. Presently, the value of their pro bono services have been evaluated at over $250,000. On behalf of the Foundation for the Children of the Californias, I would like to invite you to join us in this exciting project.
We have before us an opportunity to accomplish a great and wonderful plan. Please join us so that when children raise their hands in need, help will be available. The Foundation for the Children of the Californias, building a better tomorrow today for all our children.
Thank you.